Hello my viewers and welcome back to my channel. If you're new here, then don't forget to subscribe, like and share your thoughts on what you think about this video. Now in today's video, we are addressing the aging global health crisis of M.P.O.X, recently declared a global health emergency. Now this viral infection, which has severely impacted the Democratic Republic of Congo, is now spreading rapidly through East Africa and other parts of West Africa, with the World Health Organization reporting a new fast-spreading and deadly variant of M.P.O.X. The situation demands immediate action. Now, governments must mobilize resources, implement containment measures, and potentially close borders to curb the outbreak. So join me as we take a look into the M.P.O.X crisis, understanding the virus and its rapid spread, examining the World Health Organization's response and global efforts, and highlighting the devastating impact on affected communities. Check out these videos. I will be right back, and when I do, I'll share more information on this.
And you will have seen the announcement made by the World Health Organization yesterday, in which it determined that the surge of M.P.O.X in the Democratic Republic of the Congo and a growing number of countries in Africa constitutes a public health emergency of international concern. WHO is warning also about the potential of this M.P.O.X virus to spread further across countries in Africa and possibly outside the continent. To allow for an immediate scale-up, WHO has released $1.45 million from the WHO Contingency Fund for emergencies. It may need to release more in the coming days. The health agency, however, anticipates an immediate funding requirement of an initial $15 million to support surveillance, preparedness, and response activities, and is working with countries and vaccine manufacturers on potential vaccine donations. The organization appeals to donors to fund the full extent of needs of the M.P.O.X response.
Is there anything the UN is doing for UN headquarters? In other words, I understand you usually follow New York City protocol, but with UNGA coming up, is there any requirement for vaccinations, or are you doing anything? Thanks.
There's no requirement in this country. The countries that are being affected are mostly the ones in Central and Eastern Africa, and you can see the WHO website for more detail.
Many thanks for joining us this evening. What does it mean when the World Health Body like WHO declares a global health emergency?
Well, Samson, I'm actually very impressed by the coverage you're giving this news. It gives the health issue at hand a lot of weight in terms of how serious we all should take it and respond. It also puts governments, healthcare providers, hospitals, and immigration officials, including border patrol officers, on very high alert to minimize the spread of such a highly infectious disease from one country to another. So it also calls on Centers for Disease Control in different continents of the world to issue guidelines and safety measures that citizens should be, informed about. This is what Africa CDC should be doing, and I believe it is doing, especially in Central Africa, and to protect the spread of M.P.O.X to neighboring countries. So it's a very serious health issue that can spread very quickly and lead to deaths. Samson.
Esther, what part of Africa is most affected, and what is being done to stop the spread?
Unfortunately, the Democratic Republic of Congo has been impacted most by the outbreak of this viral infection, and sadly, it is also spreading to neighboring countries of East Africa. So Uganda should be on very high alert, since your neighbors there, Kenya, Tanzania as well, must be on high alert. So the World Health Organization says M.P.O.X has a new variant as well, and that's very concerning too, because this variant spreads very fast and it is deadly. And so besides the Democratic Republic of Congo, the World Health Body also says M.P.O.X is also spreading in other parts of West Africa, and it is working to stop that spread by putting resources together to respond to the crisis, meaning governments have to act very fast. They also have to put measures in place, including where necessary, close the borders if there's a threat of spreading M.P.O.X. And heeding the advice of W.H.O, which has international health regulations that are very effective in coordinating this kind of response, Samson. So this is the time for everyone to be vigilant. And I'm sure doctors in Uganda and healthcare experts there will be on television, will be on NBS as well, talking to Ugandans and other citizens in the country. And it would be very important if they also speak in ethnic languages where people can understand what M.P.O.X is about and how to protect themselves. Samson.
I'm sure by now you've heard about monkeypox or M.P.O.X to make it less stigmatizing. It's actually circulating in Eastern Africa and so many people are worried, and you should not be so much worried about it because it's less severe compared to the other cousin, which is the smallpox, and I'm sure you still have the fresh memories about the blisters that you got. So for this one, they're a little bit nodular, a little bit bigger, and they start with a rash and then it becomes a little bit bigger, and then it forms crusts. You might end up having swollen lymph nodes, and this is for the same reason viruses. Most of them are usually killed by lymphocytes, and most of them are usually located in the lymph nodes. And look at HIV, look at influenza and any other virus that is a little bit more stubborn, you might end up having those being swollen. But interestingly, if you have immune system which is competent, you don't need actually to worry about it, in as much as from day 5 to 21, this is the incubation. This is when it's in the body before it produces or gives you the symptoms. But after that, then it will take a month for the lesions to heal. The issue is it might leave some scars. I'm not saying that being dark is good, but Brian, I'm not talking about Brian here. But the transmission is through direct contact, and we have speculations that it can also be transmitted through droplets. So for the contacts, I'm sure there will be someone who will be brave enough to ask whether it can be transmitted sexually in the comment region. Yeah, that's still contact. Unfortunately, there is no treatment, but fortunately, it's self-limiting. Within a month, it should have disappeared unless you're immunocompromised. But then we have a vaccine which can still work on the same. The vaccine for smallpox will still work on this around, I think the article that I saw was around 80%. So yes, we have a vaccine which is verified and working. So this one you don't have to worry about it. But then you should not worry about it as much in the first place. But first, the bigger thing that we need to do is to protect those with issues with like conditions. They have conditions in their body, like they have HIV, or maybe they are diabetic, or maybe there's a condition in their body. We need to protect them by making sure that we minimize contact, because contact is the big thing here. You will come into contact with the fluids from an infected person, especially from the hospital. Us who work in hospitals, I think we need to be a little bit more careful about the patients that we are handling. Minimize exposure to your skin and touching other people. Okay, anyway, I'm going far.
All countries neighboring Rwanda except for Tanzania had publicly confirmed cases of M.P.O.X as of 5th August, and DR Congo has experienced the biggest outbreak with 13,791 cases and 450 dead. So DR Congo accounts for about 97% of M.P.O.X cases recorded in Africa between January and July this year, making it the hotspot of the outbreak. So while M.P.O.X may not carry the same level of contagion as COVID-19, it still poses significant risks, particularly to individuals with pre-existing conditions, young children, pregnant women, and those with compromised immune systems. As we navigate this new threat, it is crucial to recognize that many of the prevention measures we became accustomed to during the COVID-19 pandemic remain effective against M.P.O.X.
The Africa Center for Disease Control, that's the Africa CDC, has now declared M.P.O.X a health emergency in the continent. The DRC, of course, is the hardest hit country, recording over 14,000 cases and over 400 deaths. Kenya has only recorded one case, but of course remains on high alert after that classification by the Africa CDC. And that classification, of course, is aimed at boosting coordination efforts. Only 65,000 doses of vaccines are available. 3 million doses are needed, and the Africa CDC has said that it's trying to procure that, but it's not known when and how it will do that. And vaccination can only begin around October. So it's a disease that's being closely monitored, and Kenyan authorities remain on a high alert.
So what does monkeypox look like? Let me show you the symptoms.
Phase 1, no symptoms. This can last 3 to 17 days after exposure.
In phase 2, your whole body is trying to fight off the virus, so you might get flu-like symptoms.
Fever, headache, chills, muscle ache, fatigue, swollen lymph nodes. This can last over a week.
And then a few days later, you'll start getting red, small, circular spots in random areas on your body.
They can look like pimples, and you might only get a few of them.
Phase 4. For the next 2 to 4 weeks, the red spots turn into very painful blisters. Phase 5. The scabs from the blisters have fallen off all by themselves without you touching them.
A new layer of skin has formed, and you are no longer contagious. By the way, make sure you do not tear off the scabs, just let them fall off.
Okay, my name is Kiram, and I've got more survival tips for you.
Now, the World Health Organization director has determined that the upsurge of M.P.O.X in the Democratic Republic of the Congo, DRC, and a growing number of countries in Africa constitutes a public health emergency of international concern under the international health regulations. Now, Dr. Tedros' declaration came on the advice of an IHR emergency committee of independent experts who met earlier in the day to review data presented by experts from World Health Organization and affected countries. Now, the committee informed the Director General that it considers the upsurge of M.P.O.X to be a PHEIC with potential to spread further across countries in Africa and possibly outside the continent. Now, the Director General will share the report of the committee's meeting and, based on the advice of the committee, issue temporary recommendations to countries. In declaring the PHEIC, Dr. Tedros said the emergency of a new clade of M.P.O.X, its rapid spread in eastern DRC, and the reporting of cases in several neighboring countries are very worrying. On top of outbreaks of other M.P.O.X clades in DRC and other countries in Africa, it's clear that a coordinated international response is needed to stop these outbreaks and save lives. Now, the World Health Organization Regional Director for Africa said significant efforts are already underway in close collaboration with communities and governments, with our country teams working on the front lines to help reinforce measures to curb M.P.O.X. With the growing spread of the virus, we are scaling up further through coordinated international action to support countries bring the outbreaks to an end. Now, committee chair professor said the current upsurge of M.P.O.X in parts of Africa, along with the spread of a new S-transmissible strain of the Monkeypox virus, is an emergency not only for Africa but for the entire globe. M.P.O.X originating in Africa was neglected there and later caused a global outbreak in 2022. It is time to act decisively to prevent history from repeating itself. Now, this PHEIC determination is the second in 2 years relating to M.P.O.X. Caused by an orthopox virus, M.P.O.X was first detected in humans in 1970 in the DRC. Now, the disease is considered endemic to countries in Central and West Africa. In July 2022, the multi-country outbreak of M.P.O.X was declared a PHEIC as it spread rapidly via air contact across a range of countries where the virus had not been seen before. Now, the PHEIC was declared over in May 2023 after there had been a sustained decline in global cases. M.P.O.X has been reported in the DRC for more than a decade, and the number of cases reported each year has increased steadily over that period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total, with more than 15,600 cases and 537 unalivings. Now, the emergency last year and rapid spread of a new virus strain in DRC, clade 1b, which appears to be spreading mainly through S networks, and its detection in countries neighboring the DRC is especially concerning and one of the main reasons for the declaration of the PHEIC. Now, in the past month, over 100 laboratory-confirmed cases of clade 1b have been reported in 4 countries neighboring the DRC that have not reported M.P.O.X before: Burundi, Kenya, Rwanda, and Uganda. Experts believe the true number of cases to be higher, as a large proportion of clinically compatible cases have not been tested. Now, several outbreaks of different clades of M.P.O.X have occurred in different countries, with different modes of transmission and different levels of risk. The 2 vaccines currently in use for M.P.O.X are recommended by World Health Organization Strategic Advisory Group of Experts on Immunization and are also approved by World Health Organization listed national regulatory authorities, as well as by individual countries including Nigeria and the DRC. Now, last week, the Director General triggered the process for emergency use listing for M.P.O.X vaccines, which will accelerate vaccine access for lower-income countries which have not yet issued their own national regulatory approval. Emergency use listing also enables partners, including Gavi and UNICEF, to procure vaccines for distribution. World Health Organization is working with countries and vaccine manufacturers on potential vaccine donations and coordinating with partners through the Inter-Medical Countermeasures Network to facilitate equitable access to vaccines, therapeutics, diagnostics, and other tools. World Health Organization anticipates an immediate funding requirement of an initial $10 million to support surveillance, preparedness, and response activities. Now, a needs assessment is being undertaken across the 3 levels of the organization. To allow for an immediate scale up, World Health Organization has released $1.45 million from the World Health Organization Contingency Fund for emergencies and may need to release more in the coming days. The organization appeals to donors to fund the full extent of needs of the M.P.O.X response. We have finally come to the end of the video. Thank you for watching and see you in my next video as I bring you another video.